This Saturday, as Rich mentioned, thousands of runners will lace up their sneakers for the Donna Marathon to fight breast cancer. Marathon raises money and awareness about the disease. According to the American Cancer Society, 1 in 8 women in the U.S. will develop invasive breast cancer at some point in their life. But there is some encouraging news, a silver lining, if you will. Talk about new research. Dr. Scott Ackerman from the Ackerman Cancer Center back here on The Morning Show. Good to have you here. I think one of the biggest things is that you approach breast cancer treatment now with some long-term objectives, not wanting to undermine somebody's health further down the road.
That's absolutely right. Our success in treating breast cancer has led to many, many breast cancer survivors. Today in America, there's about 2.8 million women who are breast cancer survivors. And this means other challenges. As women live longer, they're diagnosed at a young age, many of them, and they live for many, many years, we're concerned about late consequences of the treatment that we provide for patients with breast cancer.
Now, there are 2 major advancements, and the one that's probably the most exciting is the fact that you can offer a more targeted therapy now using proton beam therapy.
Well, we've been looking at different ways to minimize radiation dose to the breast over the years. So it used to be we would treat the whole breast, we give a lot of radiation to the breast after surgery, and that would lead frequently to long-term complications, meaning damage to excessive radiation exposure to the lungs and the heart, which leads to long-term damage to those organs. To the lung, it means problems with pulmonary fibrosis, and to the heart, it means increased incidence of coronary artery disease. Also, we're concerned about excessive radiation exposure causing second malignancies. So different approaches have been made over the years to minimize that excessive dose of radiation to normal tissues. One thing we've done before was what's called partial breast radiation, just treating part of the breast, not the whole breast. And what I'm pretty excited about is proton therapy, which is now evolving as a treatment when we provide adjuvant radiotherapy for women with breast cancer. Proton therapy allows us to treat the breast, and virtually no radiation is exposed to the lungs or the heart. And so there's significant reduction in the risk of coronary artery disease and pulmonary fibrosis.
The other positive advancement is the fact that through genetic testing, you can basically tailor a therapy to somebody.
Right. This is another great thing that's evolved over the past few years. And what we do is we take the breast cancer tissue, the tissue itself that we get out of the breast, and we send it to the lab, and a genetic analysis is done of that tissue to see what genetic defect there is in that tissue. Then that's compared with tens of thousands of other specimens that have been collected over the years to determine whether the woman is at risk for recurrence or whether the woman is at risk for spread to other parts of the body. And it tells us whether there's an aggressive cancer or not. And this helps us tailor who should receive chemotherapy and who shouldn't, because chemotherapy, like radiation, can cause long-term problems. Women that have chemotherapy can develop long-term problems with their heart, can get second malignancies, leukemias, those sort of things. So if we can identify which women don't need chemotherapy and we can avoid giving them chemotherapy, that's a good thing. And conversely, if we can identify who would benefit from chemotherapy, then those women would benefit. And so they're 2 great tests. One's called Oncotype DX, and one's called MammaPrint. And there are 2 different labs that do very similar things.
And I guess we should probably get back to basics here, because women can take matters into their own hands, and I mean that literally and figuratively. A self-exam can basically determine if you've got a problem early, and the earlier the better.
Absolutely. So I always encourage my patients, anyone who I talk to perform breast self-examination monthly, the same time of the month, once you're in your 20s. I also encourage women to get mammograms on a regular basis, speak to their doctor about that. There's been some controversy lately about how often to get mammograms, but the American Cancer Society recommends that women have a meaningful conversation with their physicians, but after the age of 40, to get a mammogram at least every year or 2 after the age of 40.
Always a pleasure, Dr. Ackerman.
Thank you.
So in case you missed any of this information, you'll find this entire interview posted on news4jax.com. After about 10:30 this morning, look under the Morning Show page and go to videos. Jen?